So everything's so specialized. I make fun of my specialty as we're so specialized. We're foot and ankle specialists. So soon, next 10, 20 years, we're gonna have a right foot specialist and a left foot specialist. So if somebody comes in, oh, I have this bunion problem. I said, oh, you have it on the right side? Sorry, I don't treat the right foot. I treat the left foot, right? I mean, that's how specialized we're becoming. You know, your knee guys do knees, and then your hip guys do hips, and the shoulder guys do shoulders. You know what I mean? Back guys only do backs. And next thing you know, we're not looking at the whole body. And how it's really ironic that a foot doctor is actually looking at the whole body, because I say, for example, I had a patient the other day come in, older gentleman. I said, oh, I haven't seen him for a while. I said, oh, what have you been? I said, oh, I got both of my knees replaced. I said, really? Oh my God. So I stood him up. I only saw him a couple times in the past for some other problems. I stood him up. Guess what? He had a completely flat feet. So I asked him, did you have any injury to your knees? I said, no, it's over time, right? If somebody looked at his feet and took care of his feet, he would not probably needed that surgery. Do you know what I mean? Because it came from the feet. When your feet are off, it affects the rest of the body, right? So we're so myopic. I call it the myopic medicine, where we're just looking at one part of the body and say, oh, you have this problem, let's fix it. Well, it's important to fix that problem, but you got to ask one more question. What's causing this problem? Or what caused this problem? If you ask that one more question, then you become a holistic practitioner, because you want to know most of the problems that I see every day on the feet are coming from the rest of the body, especially internal problems like fungal nail problems, very common problem, like gout. People come in with gout, which is an inflamed joint. It's not coming from the foot. It ended up in the foot, but it came from your diet. It came from your lack of exercise, too much stress, all the things that I teach. Unless and until you fix that problem, you cannot fix your foot problem, right? Which is what I realized. Right. So 20 years ago, that journey started for me when I was depressed again. I was paralyzed and depressed, but I started getting busier. About 5 years into my practice, I started seeing a lot of patients, and I started seeing a lot of complications for my surgeries. And a lot of them started limping around my office, and I thought, oh, what happened? I'm a horrible surgeon, right? I do the surgery, and next thing you know, a lot of people are limping around for months and years sometimes. What happened? Nobody taught me this, right? So I started looking at all the charts one night, and I realized that's not really my fault. Well, sometimes I made mistakes and I didn't do it right, but majority of the time, I worked on sick people. When I worked on diabetic patients, obese patients, multiply medicated patients, cancer patients, they did not get better from my surgery. So I asked that question, I said, how can I get my patients healthier so when I operate on them, they'll be able to heal faster? So that's why the whole holistic journey started. That's why I started looking at Ayurvedic medicine. 8,000 years of history. They use food as medicine, okay? And then Chinese medicine, Korean medicine, Greek medicine, American Indian medicine. And I studied all of this, and I realized we have all the power to heal ourselves. That's why my first book, 9 Secrets of Health, is written. Because as I researched the medicine of the whole world, I realized that our medicine is really good at certain things, but it really doesn't ask a lot of questions about how to improve the rest of us. Right. They're so focused on the symptoms and the dysfunctional area that it's missing the whole picture. So that's what holistic medicine is all about. You have to treat the symptoms because they're in pain or they're not doing well. So you have to do that. But in conjunction, you have to start taking care of what's causing the problem. Is this what they're eating? If they're not sleeping, if they're also stressed out, okay? What is it? What's causing all of this for your body to weaken and decrease your immune system, and then everything else start attacking your body?